Dubé. Dans les salons de l'huile Dubé, ok? Mais moi, je vais me débrouiller en anglais parce qu'il y a plusieurs anglophones ici, parce qu'il y a aussi beaucoup de mots techniques que je vais parler, ok? So, je suis désolé, je vous demande pardon. Mais je suis très fier d'être un Canadien-Français de 13e génération, ok? So, I'm a family doctor, non-clinical. Aussi, j'ai fait mon entraînement dans la médecine sportive. Oh, there you go, I start speaking in French again. Okay. And many of us, physicians and researchers, started suspecting something was wrong as early as late 2019. And in January of 2020, a new paper came out from an Indian research team that showed that the alleged coronavirus was genetically engineered. There were 4 domains on it that came from other sources, most notably the HIV virus. And so this paper disappeared after 3 days with no apology, just a statement from the Indian team, don't worry, we're going to get our research published someday. From then onwards, many of us saw how things unfolded and went very contrary to our medical training and our medical education. So I'm going to tell you that we've all been misled and lied to. If we follow the money, it gives us an idea of what has happened. And so there was an emergency use authorization enacted. And this was like the end, c'était la fin d'un vu. Ils ont déjà prédéterminé the end of the movie. And then they decided to write the script. And so there could not be any early treatments available. Ivermectin could not work, hydroxychloroquine could not work, zinc, vitamin C, vitamin D, melatonin, budesonide, all of these things could not work. All have been proven to have some efficacy, and together, very strong treatment, and in some cases, prophylaxis or preventative versus C19. And so when this happened, several doctors tried to speak out, and some of you may have seen a couple of my videos, the exposed videos, where I tried to show the persecution of Canadian physicians by their own medical governing bodies for speaking out and questioning the official narrative and the official public health response to this alleged pandemic. And instead, they were persecuted, some were suspended, some were fired, and that's what they got for caring for their patients. Men like Dr. Chris Milburn, Dr. Francis Critchin, Dr. Roger Hodgkinson, Dr. Mark Chauzy, Dr. Patrick Phillips, the list goes on and on and on and on. And so I did some interviews to try to expose this. We even got exposure as far as, you can say what you want about him, but he's been more right than wrong, and you see what I did there with right versus left. Alex Jones on InfoWars, we got almost 1 million views with one of our videos. And so I just want to tell you that you're not alone, and that we have been purposely misled because the script has already been written. That's already been written, and they're trying to make it true. So they are cherry picking their data. There have been powerful evidence synthesizers, les personnes les plus avancées au monde dans la recherche, la méthodologie de la recherche, qui ont fait les analyses, who looked at the analysis of the WHO and the CDC regarding ivermectin, regarding the efficacy of the vaccines, which are not vaccines, by the way, they're experimental gene therapy injections, okay, nothing like vaccines at all, they aren't vaccines, okay, and have found big mistakes. Purposeful mistakes in the analysis, okay? Women like Dr. Tess Laurie of Great Britain, she found that the CDC's analysis was full of holes. They literally took pieces of research that they wanted to take, they threw out other big pieces of research that proved what they didn't want proven. And so we know that there are other treatments that work well. We know we don't need these experimental gene therapy injections. There's the great Barrington Declaration where we can actually protect the vulnerable people. When in history have we locked down healthy people to protect vulnerable people? We always think the reverse. And God forbid, injecting children to protect adults? The fact COVID mortality for children healthy children is near zero. The flu kills more children than this alleged virus, okay? So here are some facts for you that have been backed up by research that you may or may not have heard of. Number one, natural immunity is superior à l'immunité that's given to you by an injection. Natural immunity is far superior than vaccine immunity. If they tell you different, they either don't know what the hell they're talking about, or they're lying to you purposely. This is one of the very first things we learn in medical school. The breadth and the length of natural immunity is much better than vaccine immunity. They still get reactivity in the immune systems of people who are subjected to, exposed to Spanish flu over 60 years. Okay? So the research proves that. Now we're told that this is a pandemic of the unvaccinated. Really? Really? Then why do the vaccinated carry much more viral load in their nasal passages than the unvaccinated? Why are they 13 times more likely to contract the variant than us who have not been vaccinated? Why is it that we have evidence that the vaccines are driving the variants? You never inject during a pandemic. You provide a natural selection that causes variants that can survive the injection to thrive. And so the people who are double vaccinated are carrying their breeding grounds for the variants. And they also are asymptomatic carriers. So the very thing they were accusing us of months ago, asymptomatic transmission, is occurring now in the vaccinated.